Name?
Akil sir.
Akil, come. From Andhra Pradesh.
Richardsons.
Hello. You're complaining of pain, TMJ, student, and then open. Okay. Close. Open. So since how long have you been having this clicking?
It's a long time, sir. It's been 12 years. That's 12 years. It's first is clicking some lightly.
Okay.
Negligence and what is of pain coming.
Okay.
My brother have medical going and asking his pain relief using the tablets.
Okay.
It's a critical time. More than times, very critical, sir. Joys,
Pain
paining, and clicking, not eat properly, not sleep properly, head is rotating, paining, full Asian, head is
Paining. Sir, he has problem with the jaws. Okay. His mouth is not closing. This is inside. Smile. No. Normally smile. See. Gums are visible. He will need surgery on the jaws. Only then this problem will be corrected. Otherwise, it will not get corrected. He has issues. So first you have to plan what type of surgery you have to do. Most likely it will be surgery on the upper jaw and lower jaw. Only then we can arrange the condylar head and also give a better balance of the face. This is the best solution. One more solution is there. If you want, you can try. That is some Ayurvedic treatment for the joint, some external oil application, massage and all that. But because his jaws are not in correct position, because his joint is not in correct position, that will not work for most patients. So the surgical solution is better because the treatment is lifelong. We will need 4 weeks, 5 weeks rest. It is not minor surgery. We are going to do some procedures on the jaws, change the position of the condylar head so that after it positions in the new place, once it heals, he will not have these problems. First. Secondly, also his face will look better. Lip is looking big, will look smaller. Gap between the lip, finish. This length more, this projection, angle, everything we will get. Along with the improvement in the clicking. So no clicking, less pain, better looking. Right? But we have to plan for this. Scan has been taken. Then I will tell you the overall planning. They will tell you the costing outside, my staff. After that, we can proceed for surgery whenever you want. It is not emergency. You can do surgery 1 week later, 1 month later, 1 year later, 6 months later, whenever you have time. So because he's a student, he needs about 3 weeks to 4 weeks rest. So plan like that.
Sir, complete the BCom.
Okay.
I will join the theology in Bible College.
When?
Management.
Which month? Which year?
Which year? This year, 6 months.
So if you have time, we can do. You have to just see that you need 6 months time. That's all. We can solve the problem. All right?
Yeah, is medicinal.
Dad asked me.
Medicines, it will not work for a long time. You have to regularly keep on taking medicines.
Permanent solution, sir, but
surgery only.
A lifetime solution.
Lifetime solution. Riju.
Was there very poor family, sir, my family, so only one son. Tell me the amount I will.
Yeah, it will be not very less amount because it's a major surgery. Surgery will take us 3 to 4 hours and you have to stay with us for 1 week. Hospital for 5-6 days. So medicines and plates and screws, some cost will be there. They will tell you cost outside. Then you decide and then we can do. Okay? इनको बताओ रिजो से डाउट 1 मिनट दो मेरे को विजय लक्ष्मी को बुलाओ all will go after surgery, it will settle down. Okay, bye.